This one's for Mari too. Mari and others.
Okay. Okay. For somebody coming in with an active post-concussive headache, would you consider HRV or similar training or not do any training? Well, you're going to get my it depends answer. If you've got a massive, big, pulsing headache that Jay was referring to, we don't want to do anything. You might want to consider some temperature regulation or some basic bio to just see whether you can get the generalized arousal down. I don't claim to be an HRV expert, but I mean, if you want to do some breath work a little bit to take it down, but I don't want to be pushing your resonant frequency. I would go really, really conservative on this. But again, I don't have a lot of information with an active post-concussive headache. I mean, there are headaches and there are headaches.
The term active post-concussive headache means that they need to be going for assessment.
Yeah.
If you have a post-concussive headache, you have, if you're lucky, just ischemia. At worst, you may have a bleed.
Yep.
If the bleed is subdural, you can last a long time with a
Yeah.
subdural. But if it's an epidural, you have a matter of hours if you're lucky. Very seldom more than hours. You need to be seen. And if somebody has a post-concussive acute circumstance with a headache, that's time for the urgent care facility, not neurofeedback or biofeedback at that point. When they come in the door with a fresh scrape and they say, I just hit my head and I got this headache, this is time for urgent care, not for HRV or any neurofeedback.
We've all had that. I've had people come in where, the eye is still bleeding, help, and I'm like, you're in the wrong location. Go around the corner to the hospital, please. Yeah. No, I mean, we do with humor, but, I mean, it's lovely that people have such confidence in our profession, but we all have to know not just our scope of practice, but when to send people to the right place.